Press that
I
red
did.
button.
Okay. Okay.
Tell me when. Okay, so I have here Mr. Zalay.
Good, good. Everything worked well.
So John, can you tell me a little bit about we just had a procedure done probably about a week ago,
Yes.
and tell me about your symptom before. What was really bothering you before?
The worst part of it was being able to walk. I wasn't able to walk for long
Okay.
distances without extreme leg pain.
Okay, and tell us about your leg pain.
They were always mostly on the top, involving muscle. Could have felt sometimes it would have been in the bone, but it was always mostly on the top of the leg after walking for short distances, and then I have to sit down and relax for a few minutes, 5-10 minutes, until the pain goes away, and then get up and resume my walking.
And how long has that been going on?
About a couple of years.
Couple years, okay. And you had some kind of wicked back pain that you...
Yes, I do have a situation where it does get extreme. It does cause me to pass out, vomit, or just lose complete control of my legs and fall to the ground.
And how often did that happen?
It would happen at least once a week.
Once a week. And how did you deal with it before?
A lot of morphine.
Okay.
And bed rest, pretty much.
Okay. And so we did a bunch of stuff before, including ablation, including burning the nerve, etc., and
Yes.
epidural injection, a whole bunch of things.
Yes.
We go way back. And so finally we talk about this minimal decompressive procedure where we try to treat your spinal stenosis. Essentially that's what you have, the major of your problem.
Right.
So we did a procedure about a week ago, and just tell us a little bit your experience after that.
Truly, the experience has been amazing. I'm able to do things that I've forgotten that I've been able to do. Simple things, walking. I can walk now without any leg pain. I've walked 2 hours already, Sunday, without any kind of leg pain. I prefer standing instead of sitting. When I sit up straight now instead of slouching down. My body positions are such, I have so many more choices now. It's kind of amazed me.
Okay.
The difference.
You mentioned earlier a while ago about how do you sit, how do you typically sit before and after?
Okay, while we're watching the video, typical sitting before would have been something like this. Now it's straight and it's extremely comfortable.
Okay.
I can't describe it. The best I could describe it, I told you before, was like Forrest Gump losing his hardware when he was running. I have all these new sensations that are they're just great.
And I think the first day you come back for follow-up, you mentioned about lying down.
Yes, it's also changed my extreme pain, and all came from the same spot. And it would give me problems when I would lay down on my side. I guess I would pinch something inside my body, and I have to constantly change positions. In the last week, immediately after surgery, that first evening, I was able to lay on my one side or the other side. I was able to lay on my back. Things that I haven't done in a very long time, very comfortable positions. I found myself sleeping a little bit better at night. It's amazing what this procedure has done for me. It's truly changed my life.
All right. I mean, I guess overall, I mean, would you think this is something that,
I'd highly recommend it to anybody that's facing a fusion. Don't do a fusion. do this.
Well,
this works better.
Of course, I think very important part is actually candidate selection, and I truly, and we talk about this. I think we've been talking about this for about 2 years now.
Correct.
Trying to get you done this a while ago when it was a little bit more, earlier. But I think the patient selection is actually the most important part, and I think you're a great candidate for it. And great candidate being with a great procedure, I think it can have good results. And I just want to I'm glad. Actually,
So am I.
We've been knowing each other for what, 4 or 5 years?
4 years now.
4
I've been
years
coming
now,
here to
and-
get straightened out.
And you remember how you were the very first time I saw you,
Yep,
and I remember
I
how
sure
you
do.
were.
That's a little on the rough
You know,
side,
it was,
but
yeah. And it certainly wasn't a whole lot of smile that time.
No, no.
But, good. All
But
right.
your procedures and the effort that you've put into my particular case and the amount of time is greatly appreciated. You did an excellent job. You picked out all the right things to do every single time. It took some time to get through it all, but it's well worth the fight, and it's well worth it.
Okay.
My enjoyment
Oh,
of
no.
life is completely changed.
You're gonna make me
and
cry
I
here.
thank you. I'm about to cry too, so.
No, but yeah, I think it's a partnership. It's really, it's really not because of me. It's actually both of us.
Correct. Correct.
Because we've been to a whole bunch going up and down, and as far as whole medication, all that stuff.
Correct.
Yeah. So, all right. Well, hey, cool. I'm
Thanks.
very glad, man.
Great
so,
job,
so
man.
glad,
Great
man.
job.
So we'll see. Hopefully, we can have more. More results like this.
Yeah.
I think this is one of the rare cases where hopefully it won't be rare anymore. But in pain medicine, this is something that I cherish for a long, long time.
And anything that I can do to help encourage others, I'd be more than happy to participate.
I appreciate that. Thank you.
You're very welcome.
All right.
My pleasure. Holy Cross.
All
God
right.
bless.